Thanks to an unconditional grant from our generous sponsor, Teva Neuroscience, we're happy to offer you this educational clip concerning multiple sclerosis. This clip is intended to improve your general knowledge of multiple sclerosis. Among other things, you will learn exactly what MS is, along with the causes of the disease, who can get it, and the most effective treatments available today.
Multiple sclerosis is an inflammatory disease of the brain and of the spinal cord.
The body's immune system that normally responds to infections and other challenges from outside, in the environment, now the immune system, the immune cells are moving into the brain, and they are causing damage to specific structures, mainly the myelin in the brain or even the nerve fibers that underlie the myelin.
It evolves by bouts or exacerbations or relapses interspersed with periods of remission. It's not contagious. We know this very well because people that live together, like husband and wife, if one has the disease, it's very, very, very rare that the other person gets it. It's not more often than by chance. It's not really a genetic disease, like diabetes might be. But there are genes of susceptibility. It affects young people, women, men. It's probably around 200 patients per 100,000 population. So it's frequent.
So multiple sclerosis is multiple areas of the brain in which the myelin and the nerve fibers have been attacked by the immune system. Now, depending on which part of the brain you damage, that would be the symptom. So if you damage the myelin and the nerves that go to the eye, the optic nerve, a person would get difficulty with vision.
Numbness, hands and feet, coordination problem with the hands, balance problem, weakness in the legs, fatigue, problems walking, bladder, difficulty to hold the water. It's very variable from one person to the other. There's still a percentage, let's say 15%, that will spend their life without being seriously handicapped. But just having MS, just being told that you have MS is a weight that you carry with you all the time. There's always a threat.
What is activating the immune system to go to the brain? We don't know that specifically, but we think that the immune system has been inappropriately activated.
It's probably a combination of various infectious agents.
But the complexity in people is that everybody's immune system is different than the other person's.
The reason why X has MS is different from the reason why Z has MS. It's probably different from one person to the other. If you have a 23-year-old lady who has inflammation of one eye and 3 months later she has numb legs, if she doesn't have other diseases, it's a done deal. But of course we do other things. We do an MRI of the brain and of the spinal cord sometimes, and then we can see the lesions.
The MRI becomes very important because it tells us about overall disease activity, and we want to be able to use our therapies to control overall activity.
We also do a spinal tap to see some special antibodies that we can find in the fluid in there. So I would say that it's rarely a problem to diagnose MS, even in the early stages.
There are many forms that are described on the basis of the person either having attacks from which they recover.
You have a relapse, it lasts about 2-3 weeks, and then you go into remission. So that's the relapsing remitting form.
Or there are some people who go on and get a more progressive disease.
Your disease evolves in a continuous, slow manner. But there's a high percentage of relapsing remitting that become progressive after a while. So we call this secondary progression. And this is what we are trying to prevent. But we don't have a good medication or treatment to do this at this time.
Now that we're treating the disease earlier and earlier because we can diagnose it earlier by MRI, if we stop all the inflammation at the very beginning, will we prevent the secondary progressive disease? We have to hope that that's true, and we'll gradually know that.
They are not cure. They slow down the disease. The relapses are less frequent. They are less severe. And we hope that they delay this secondary progression, but that's not an established fact.
If we look back 20 years ago, and you look at the major medical textbooks about multiple sclerosis, and look under therapy of multiple sclerosis, there was nothing written. So that in 20 years, we've moved into therapy of multiple sclerosis. We've had the great advantage of having the MRI so we can actually see the disease, so that we can evaluate impacts of therapy, and we also have our advances in understanding how the brain works.
We will find something, but it's going to take a while because it's extremely complex. There's an interplay of host factors, environment, infections, genes. So at this time, there's no cure, but everybody's working in that direction.
For more information on this topic, don't hesitate to contact us at 1-800-268-7582 or visit our website at www.mssociety.ca/QC.